Good morning. I'm Nancy with the Hospice Care Plan. I received a comment from our YouTube site this morning that made me really sad. It's not the first time I've received this comment, and I know it won't be the last. The woman who wrote said hospice had killed her husband. I know that when someone loses a spouse, it is extremely distressing. And when hospice has been involved, sometimes in a very short time, there can be an understanding that we are the ones that actually caused the death. In this case, what I hear often is hospice came along, gave morphine, and my husband died. 3 doses, and that was all it took. I shouldn't have ever had hospice. That is unfortunately what people think about how we manage someone's pain. Generally, of course, when we come on board, the very first thing we do, and that's through Brenda and I, we look at a patient and find out what is the general kind of care that will help them be more comfortable. Please visit our website. We have 70 videos or so on how to take care of somebody in bed or when they're ill. So we always start with care. In fact, that's our motto. Care is treatment. At some point, though, to provide comfort for a patient and to allow a family member to see their loved one not in pain, we do offer medications for comfort, and those medications can be very, very powerful. We start with lower level medications and progress as a doctor provides us with an order so that we can find comfort for the patient. And generally we include family in all those decisions so that the patient and the family are accepting or understanding what the plan of care is. Oftentimes, as I've said before, patients come to us because they have a terminal diagnosis. We can't even admit a patient unless they have a terminal diagnosis, and they are far along into their pathway towards death. And so when we finally find comfort for that patient through use of medications, they are finally able to relax. And when they're able to relax, they can let go, and death occurs. And if that's in a few days or a few hours when hospice came on board, it's very understandable that a family can think that we provided the path and caused the death. That is never our intention. Medications are always offered in the smallest amount to begin with. We offer a low dose and we go slow. I'm very thankful that many of the people that I run into are very respectful of high-powered medications. Because of what's happened in our culture, of course, it's a very important thing to be aware of. So respect for medication is very important, and Brenda and I always start low, go slow, and make sure the family is aware of what we are doing. We often provide that first dose of medication right there with the family so that we can stop and watch the patient and see how it's affected them. It's very interesting that sometimes patients have lived with their symptoms for so long that they can't even recognize the improvement in their condition, but I can, and a family member can too. Wow, you were breathing 30 breaths a minute a little while ago, and now you're only breathing 20. Doesn't that feel great? So again, I'd like to emphasize that hospice is there to assist with comfort. And the final thing is that I'd like to say that hospice also provides for bereavement care. And I certainly hope that the hospice that was involved with this woman will provide bereavement care for her after her husband's death through her nurse, the social worker, and her chaplain. Losing a loved one is a terrible type of grief, and hospice does provide for after-death bereavement care. So I hope that she's getting that. Please join us to learn more about hospice so that if you have a loved one or a family member or a friend, you can help them to understand what we can do to help a patient find comfort. Thanks so much for listening, and check us out on the Hospice Care Plan.